Hyper-arc radiosurgery is a way to efficiently deliver high-dose radiation to brain tumors. So even patients with multiple brain tumors can receive treatment in around 20 minutes, whereas other technologies took upwards of an hour or two to deliver the same treatment.
This equipment can treat more than one tumor at a time. It's specifically for treating brain tumors. And the time that it takes to treat the tumors is a lot less than with the regular equipment that they had before.
So if you look back in the Cobalt days, the goal was to have a very uniform distribution of radiation from one side of the head to the other. It was very uniform. That was the theory and necessity with that technology. Now, we don't necessarily want to treat all those other areas of the brain to high dose. We want to keep the dose as low as possible. The table here behind me is a 6D couch, which gives ultra precision to position a patient without having to come in and out of the room.
It treats every spot that the cancer is spread to in the brain simultaneously. That really cuts down on the treatment time. What used to take an hour and a half is now often 15 or 20 minutes.
Hyper-arc radiosurgery is also more precise, which means less dose to normal brain tissue, and that means less side effects for our patients.
Basically, when you're looking at the anatomy of the room, the radiation comes out of the head of the machine here, and then we have 1, 2, 3 devices devoted to internal imaging. So basically, we're looking at bony anatomy on the inside of the patient. You also have cameras that we're using to view the patients from outside of the room. We have cameras up here that are devoted to paying attention to the patient's breathing while they're being treated. And then we have another set of cameras that's devoted strictly to the surface area of the patient. So when things aren't aligned properly, it's giving us consistent cues about what needs to be adjusted. So now that the patient is actually in the treatment position, now we'll bring out the imaging arms to prepare for the first set of imaging.
Deep inspiratory breath hold is a way for us to take into account tumor motion caused by patients' breathing. With deep inspiratory breath hold, we are able to treat the tumor while decreasing dose to surrounding normal organs such as heart and lung.
We were really excited to be one of the first hospitals as a community hospital to have this equipment, and we think it'll be great for patient care.
The 6 degrees of freedom couch is a way to more accurately deliver treatment. This means shorter treatment times, which provides our patients with a more comfortable experience. We are so grateful to the Auxiliary for this huge contribution to our cancer center. We're blessed to be able to offer these newer technologies to our Infirmary Health patients.